Hello, and thank you for joining us for part one of our Practice Profitability Comp Care series. So I did have to change up the format just a little bit. So you're aware you can throw your questions in the chat box. We do have an admin moderator that can answer those. If you are watching this on a replay, you can send those questions to info@mintconceptions.com. We'll be happy to have that conversation with you. I'm going to roll through these first few slides to give any stragglers a little bit of time to possibly hop on. Um, the goal is 45 minutes. It's set to run for an hour, but I'm shooting for 45, so fingers crossed. So this is our Comp Care series. We are Mint Conceptions. We are business strategists dedicated to delivering tailored services that meet your unique business needs. So essentially, if you have a business issue, we likely have a solution, and that is what really sets us apart. Any questions you have, throw them our way because we likely have some way to help you. So who am I? I am Ashley Boaz. I have been a licensed hygienist for the last 16 years. I've been in dentistry for over 25 years. I've worked in almost every role in the practice, so I'm acutely aware of the issues you face. I have several of my own businesses. I've helped many others along their entrepreneurial journey, building profitable businesses to eventually selling them as they transition into the next phase of their careers. So dentistry is a passion for me. My mother got braces when I was about 9, and I was hooked. I thought it was the coolest thing ever. So I knew I was going to be in dentistry from that day forward. And as careers often do, my path evolved over time to eventually hitting HR and returning to business school because I knew there were pieces I wanted to add to my knowledge set. At the end of the day, business is business, and I feel there's much to offer across industries, and this allows me a greater perspective and opportunity to innovate. And that can get lost a lot of times when we're closed off to other fields. So we don't work exclusively with dentists. We work with leadership to drive change, and this became my passion as I started my own entrepreneurial journey, kind of shifting my focus. I started Mint Conceptions with the hope to change businesses around the world by instilling ideas that could reshape the way we consider the everyday opportunities we're presented with. And that brings us to our Comp Care webinar series. It's my way of giving back to a community that's given me so much over the years, and I really hope you guys enjoy it. So this course is designed to equip dental professionals with strategies to enhance your practice profitability while also fostering those deeper connections with our patients through the comprehensive care we offer. We're going to understand dental care principles of comprehensive care, the basics of relationship building, strategies for improved treatment acceptance, methods for getting those repeat satisfied patients, and explore some additional revenue stream opportunities. So this is for pretty much anybody in the dental practice, and we are going to kind of roll through these a little quickly, but I am happy to answer any questions. So, what is comprehensive care? It's a healthcare approach that aims to provide holistic, person centered care for your patients. So, there's a crossroads of wants versus needs, and we have to meet them in the middle. It embraces a holistic approach to dental care. It centers around the patient's overall health and preferences and combines preventive, restorative, and cosmetic dental procedures. It prioritizes patient-centered care overall. So what it isn't, it doesn't ignore those intersections. It doesn't take a fragmented approach to dental care. Now, sometimes we will have to when we have those limited cases come in, but overall, you want to be pushing for a comprehensive review of their health. And you don't want to focus solely on one of those pieces if you can avoid it. That may mean you have to network with your peers, providers that offer services. I know I have some specialists on this as well. So making sure you have good working relationships with the other providers, the specialists, whoever you need to work with to make sure you're providing patient-centered care that really meets all their needs. So the benefits of comprehensive care, it increases their satisfaction, improves patient outcomes, you have a higher case acceptance, and long-term profitability for the practice is built in. So let's dive into those barriers to care. So we have to understand the why behind the no. For different practices, these are different. So for pediatric, you're going to have to tackle more of those parental hesitations where, general dentistry, it may just be the patient themselves has concerns about safety, efficacy. Financial concerns are across the board. They could have concerns about high out of pocket, depending on how your office is structured and what kind of plans you do or do not take. They may have concerns about the necessity of the procedure. Is it aesthetic or elective, or is it absolutely necessary? They may have fear of trauma, anxiety, worry, or they want to delay for the wrong reason. So at that point, it's your job to educate them, make sure they understand the risks of delaying treatment. Insurance limitations. Have you marketed to attract patients that are focused on their insurance benefits? So they may have more restrictive behaviors. And the time lifestyle commitment. Can they commit? And this is particularly an issue when you have those extended treatments with, say, ortho. Lack of knowledge can also be a factor. They need to understand the consequences of delaying treatment or downgrading treatment so that they have the information to make a better choice for themselves that fits their lifestyle goals. So the barriers we create are many, actually, but the lack of personalization in patient interactions is a big one. And that can happen when we start having a high volume of patients, so we get shorter appointments. The inconsistent treatment recommendations across providers can happen when you have multiple providers in a practice. So you want to make sure everybody's kind of on the same wavelength in what they're recommending. Having limited or non-existent same-day treatment availability. So a lot of times when they're in the office and they have an immediate need, they want to do it then. So if you can offer them that opportunity, that's better for your practice, better for them. Insufficient financial conversations during the visit. Sometimes we just don't talk to them at all about it or what they need to be doing. And this happens a lot when they come for their hygiene visits. They're an established patient, they're just here for a recall. So we don't really talk about that outstanding work that we already talked about before, but they forgot about it. So it's better to bring it up than to not have that conversation at all. The data gaps in identifying missed opportunities. So there's a lot of information that can be lost if you're not really focused on those analytics of your practice and understanding what opportunities there are on your schedule. Underutilization of preventive care and wellness visits. Like I was saying, not discussing those financial pieces when they come in for those recalls is one piece of that, but also not using those visits to capitalize on opportunities while they're there. Limited staff training on patient engagement techniques. This would be their communication style. That's why part of why I'm doing this is communication is one of the biggest pieces we see with all businesses that kind of is lacking. So helping build into that. And ineffective follow-up systems and tracking. Are you reaching out to your patients to schedule those follow-ups? Do you have a system in place to do that? And are you tracking how effective you are at getting them back on the schedule? So in all patient care situations, both general and specialties, effective communication that addresses financial, emotional, and informational concerns can help improve your acceptance rates. So holistic patient care is treating based on patient and provider desired outcomes. So the best way to do this is with active listening during your patient triage, understanding their history and lifestyle and how that impacts the choices they're going to make, completing a comprehensive oral exam. I don't know how many times we don't have a perio chart. And as a hygienist, that's one of those pet peeves for us, but it's something that can give you a lot of information about the health of your patient. Evaluating the patient needs, wants, and health status overall and just how they are. Customized treatment plans for each patient based on multiple factors. Understanding maybe Susie can't remember to brush her teeth. Is it really best to do top of the line dentistry, or is it time to discuss some options for her that might be a little better suited? Creating lasting connections through building that rapport with them, and part of that is the communication style that you use. So, what is active listening? Active listening is engagement with the other party. So, a conscious effort to fully engage with another person while they are speaking with the intent of understanding what they are saying and why. So, the easiest way to explain that is to be a human first. slow down. Act like this was your family member that you were speaking to. You want to be attentive. Listen to what they're saying. Make them feel like you care about what they're saying. Ask open ended questions. Have curiosity. If this was your mother, you would ask more questions to understand why she feels the way she does. Get those clarifications and then paraphrase back or summarize what they said to you. That way they know you heard them, they feel heard. Show empathy. They're humans. You're human. We all go through a range of emotions in every day. So connect with them in that way. Be sure to use open body language, and we'll get into that more, and observe their body language so that you're responding appropriately. And mirroring is another technique that can help build that trust. So we're often left at the intersection of wants and needs and deciding what's more important. For your patients, people buy with emotion and justify with logic. And this rings true. I don't know how many times what we need to pay X, but we went and bought Y because we wanted it. And then we justify that so that we feel okay with our decision we made. So, how do we help determine what's important and to who? One of the theories I really like is Maslow's theory of human motivation. And this kind of uses a tiered hierarchy to understand the drive behind the decisions people make. So, with the hierarchy of needs, patients will progress upwards as each of these needs is met. So, we start at the bottom with physiological, which is the base needs. Let's call this survival: air, water, food, shelter, sleep, clothing, the basics of just getting through their day. Then, once that need is met, they can address safety needs, personal security, employment, resources, health, property. That rolls into love and belonging, friendship, intimacy, family, and connection. And then they work on building esteem. So, respect, self esteem, status, recognition, strength, freedoms. And then self actualization, trying to be the best we can be, is like the top tier. So, with this, it's easier to understand when you think of it as survival is that base, safety is next, because we got to make sure we're safe. Love and belonging is right above that, esteem, and then self actualization. So, what does this look like in clinical practice? So, you've got your preventive, pretty, and pain. And I always start with pain as number one. Pain is what's going to get them to do it right now. Sometimes they'll do it even when they don't want to because it's hurting them. They can't go through their day like that. So, pain puts them on that lower scale. Those base needs are not being met. Maybe they can't eat. Maybe they can't drink. Maybe they can't sleep. Base needs are not being met. So that's a hierarchy number one. We got to take care of that. Then we kind of roll into pretty. That one is more safety. Can they get employment? Are they able to have relationships? Do they feel like they fit in with their peers? Their self-esteem in general. And then you can get into that preventive section. This is self-actualization. They feel good about themselves. Maybe it's just some things to help them feel better about their own self-esteem. And they're building blocks. So you can help bridge that gap for them in your conversations with them. So again, be a human first, listen for their hierarchy of needs. They will tell you if you ask what's going on. They're going to give you lots of details. So we can safely assume that if they're in your clinic, if it's private practice and not at the health department, that their basic survival need has likely been met. Now, this may not be the case if you take Medicare, Medicaid, or you are working in a health department, then they might be more in that survival mode. This is going to be a little harder for you to have those conversations about aesthetics or preventative. They're just there for the base piece. When they're in pain, their safety and possibility of survival need has not been met. So it's easier to have those conversations with them in regards to how this is impacting their lives. They will give you lots of information. You just have to wait and ask, be patient, be quiet. Ask the question and wait for them to answer. What is this causing for you? What's going on because of this, and they'll give you lots of answers. So, pain creating the inability to sleep will often force care without much further intervention, since this is a base need and it must be fulfilled before any other. Tolerable pain will not be addressed until you've met other needs in your discussion with the patient. When we deal with pretty, this is where there's a cosmetic concern. Maybe their esteem or love section hasn't been fulfilled. If left unchecked, it can also impact the safety needs through their health or employment concerns. If a need has not been met, so that survival, safety, love, esteem, they'll not likely proceed. So, this is why cosmetic is always a harder sell unless it impacts a base need. So, employment, reproduction, or often they try and do what's best for their offspring because we try and give them the best chance, right? So, more often than not, you'll see orthodontists. They see a lot of the kids, teens, etc., and less of the adults. And there's lots of reasons for that because once you're an adult, you don't like going into that ortho phase and having the full thing because that is a uh, esteem concern once you are an adult. But there are ways to have that conversation with them if they are having an issue where they feel like maybe they're not received as well because of their smile. Asking the question about how this thing is impacting their life will give you so much information. And preventative. So preventative, it's all of their needs are met. Prevention will meet their highest level for being the optimum human. So while meeting their safety needs and maintaining their health. And this is the last on the list of hierarchy since all of their needs have been met first and they're just in a maintenance phase. So, how do you tackle this? You're going to triage, listen, and diagnose. And you'll treatment plan in that order. You go with pain, pretty, preventive. Pain is number one. However, if they tell you something is more important to them, do that first if you can meet their need. They will be more likely to oblige what you want, health, if you accomplish what they want, psychological. They want what they want. It doesn't matter what you say. So you're going to have people that come in and they're like, I want my teeth whitened. And you're like, this is bad. I need to fix this. And they're, no, I don't want that. I want my teeth whitened. If you don't address what they're asking for first, the odds of them being repeat patients is pretty low. If you need to address something in combination with, that is a different way to frame it with them so that they feel like they're getting what they need, but you have to do this thing to make sure it's effective. So, or say they want the whitening, you're going to want to do the whitening in combo with those fillings so you can match up the new tooth shade with the new filling material. So, you're going to look for those opportunities to meet their needs. Start from that human perspective. We all have the innate desire to be the best we can be and meet our potential. So discuss with them, what do you see as the ideal outcome for your care? Understand their desires to make appropriate treatment recommendations. Get on their level and follow along with their train of thought so that you can understand and make appropriate recommendations. So, we're going to dive into body language. And I feel like a lot of people feel like they understand body language, and there are lots of subtle cues, but how can we tell if they're buying what we're selling? And sometimes we're so focused on what we're saying that we often overlook the cues they give us. So, some cues that might indicate they don't like what you're saying would be crossed arms, avoiding eye contact, fidgeting, tightened lips, raised eyebrows, turning the body away, touching the face can indicate they're uncomfortable, rapid blinking, sighing, closed fists, or pointing their feet away from you. It means they're trying to run away, they're trying to leave that conversation. So I've got a few examples in here. Obviously, she has a furrowed brow. She's looking away. Her arms are crossed. She's giving you all the markers that she is not happy with whatever's happening. This lady has the raised eyebrows. And this one could be lots of things, but often it's she's not buying it. She's not believing what you're saying. And this guy, he is smiling, correct? But he rapidly blinks. He raised the eyebrows. He's not entirely sure he agrees with what you're saying. So we may be thrown off by the smile, but the eyes tell us more about what he's thinking. I throw this one in here because it seems like at first glance, this is a totally normal interaction. They're fine, everything's good, they're happy, right? But if you look closer, he is turned away from her. So maybe he was on his way to a meeting and she accosted him on the elevator or the escalator and was like, let's talk. And he was like, okay, let's do this. But she's also leaning back. So she feels like she doesn't have enough space, personal space. So if patients lean back from you, you lean back too. You give them a little bit of breathing room. So that one, it gives us a couple little examples. So then subtle body language cues that indicate someone does like what you're saying. You've got nodding, maintaining eye contact, leaning in, smiling, mirroring, relaxed posture, positive gestures, so thumbs up, engaged facial expressions. That would be like nodding and smiling with you, smiling along with appropriate points in the conversation, forward leaning posture, and laughing, appropriate laughing. Inappropriate laughing could indicate anxiety. So this guy very clearly likes what you're selling. These ladies are mirroring each other's body language. So they have the hands forward in front of them, smiling faces. They are leaned towards each other. In this one, we have everybody in agreement, nodding along with their, I don't know, manager, someone that's putting everything together, and they're in agreement of what's going on. They all have similar body language. Now, in this one, everybody seems to be in agreement except for this one lady who either she's completely checked out or she's taken notes. But this snapshot still in time, we're not really sure. But the looking away would indicate that she's not interested in what is being said in this meeting. So the power of mirroring. So this one's a big one for building those long-term relationships with your patients. Mirroring is a technique of subtly mimicking the body language, speech patterns, and attitudes of the person you're interacting with. It creates a sense of rapport and connection by making the other person feel understood and valued. Now, why it works. We're drawn to similarity. So it gives us psychological comfort. People are naturally drawn to those who resemble them. Mirroring fosters subconscious sense of familiarity and trust. It enhances your communication by aligning your behavior with the patient's and can make interactions smoother and more harmonious, leading to a more effective communication. So steps to effective mirroring. You want to observe and pay close attention to the patient's body language, tone of voice, speech, and the pace that they're speaking. Reflect, subtly adjust your own body language and tone to match the patient's. This could mean matching their posture, gestures, their energy, their level of enthusiasm. Maintain your authenticity. Ensure that your mirroring is natural and sincere. Forced or exaggerated mirroring can have the opposite effect to make the patient uncomfortable. So kind of like stop copying me, stop copying me. You don't want to go down that road. You want it to be a relaxed and natural thing. So the benefits of mirroring, it builds that rapport, the trust, it establishes the connection with the patient because they build that confidence in you and your services. It improves persuasion. When they feel understood and comfortable, they're more open to your suggestions and more likely to be persuaded to move forward with care. It also increases the likelihood of treatment acceptance. So a confident and trusting patient is more likely to move forward with your treatment recommendations, leading to higher production. So if they're not agreeing and their body language is giving you those cues, so check your body language and your mirrors. How are you doing with that? Clarify with questions. Did you actually meet their needs and what they were expecting from today. Practice empathy. They have likely expressed some sort of emotion to you during that appointment. Relate with them. Share a similar story if you need to. That build that connection with them. A lot of times we get really concerned with being professional providers, but at the end of the day, they want to know you're a human who cares about them. So redefine their stated goals after you've clarified everything with them and focus on meeting their needs first. If you put together a treatment plan that prioritized urgency as what was most important to you, did it actually cover what was most important to them as well? And be sure to take time to create those connections. Some of you may have difficulty with this because of the time constraints on your appointments. I urge you to make sure you have enough time in your appointments to build those connections so that they are repeat patients for you. So, putting your knowledge to use. We forget more than we realize. So, with that in mind, this is the Dunning-Kruger effect. So, when we start out, we have low confidence, um, low experience, and then we start building this confidence level, and it's peak of Mount Stupid. And then we fall back down in this valley of despair where we feel like we don't know anything. We get kicked that one good time and we're back down. And then we start to build back up the slope of enlightenment where we become more comfortable in our own skin. And then eventually the plateau of sustainability where we're comfortable, we know what we're doing, and we're confident in what we're doing. What happens after that is we get complacent. And eventually it leads to some forgetfulness. Maybe we don't focus as much on um, retaining those pieces that were super important to us back in school. So you want to always continue with your continuing ed to make sure that you stay fresh and ready to meet new challenges. So we have a couple of case studies where the rubber meets the road. So since we've established we forget some things with expert level complacency, let's dive into a few case studies. So this is case study 1. This is one of my patients. Joe has number 25 that is periodontally involved. He wants to keep it. The doctor determines the best course of action is extraction. How can we meet his psychological and health needs? So Joe was super concerned with keeping it. He did not want to lose this tooth because obviously it's his front tooth and he is young. He is not happy about the fact that this thing is wiggling in his mouth. So we had lots of conversations about his options, but ultimately he did not want to lose it. So there's lots of ways this could have gone. We could have ignored, the options he did have, and just kept everything in house. But this is where, building that network of peers that are able to help you better serve your patients comprehensively is ideal. So this patient is a probably forever patient. He was so happy with everything when we got done because we really did acknowledge what he wanted instead of telling him we can only do this in office. Maybe we splint it for a little while, maybe we take it out and we do the implant or a bridge, and that wouldn't have satisfied him. So we did refer him to the periodontist. The periodontist let us know. Hope all is well. I just saw blank for a 1.5-year follow-up from laser periotherapy of 2425. I emailed a sequence PAs. Please check to see you received those. I note bone fill on the mesial of number 24. His probing depths were 6 to 9, and now they're 1 to 2 millimeter. He has improved his oral hygiene in the area. So we did have to do SRP, but we referred him to the periodontist to have that laser therapy done. This patient still has that tooth. So that was originally 2016. And even on that x-ray in 2024, you can see there's a little bit of bone fill, but it was enough to get him stable, which is ideal, and he got to keep his tooth. So we have Judy in case number 2. She wants to be able to smile again for her daughter's wedding in a few months. She's been missing teeth for a while and has partials in place with remaining extractions lingering. She doesn't like the appliance coming in and out, but has financial constraints due to the wedding. How can we meet her psychological and health needs? So I know you're looking at this and there's a lot going on, right? You could do all kinds of things. Maybe you throw a bridge over here, an implant there. ultimately, we discussed with her what her goals were, what she thought was best for each of these, and her financial limitations for her overall case and getting her what she was looking for. She did phase things out, but what's the right answer? There's no single right answer for her except the one that works best for the patient. So she did a combination. There was a bridge, there was an implant. She did keep the partial in one area. So it really just depends on what works for her. At the end of the day, she was very happy. She is still a patient. So when you can meet their needs that are both psychological and physical, they're going to come back and they're going to feel like you hear them and you value them as a person. So this is Jane. Jane has periodontal disease, but came to the office only concerned with the staining she can see that is causing her to hide her smile. How can we meet her psychological and health needs? So Jane likes to smoke. Jane likes her red wine. Jane was fun for me on repeat. So what happened with her is we framed it from a we need to take care of your gum health with the periodontal disease. And in doing that, it will remove this stain you're worried about because when we go in and clean everything out, the stain will come off too. And added bonus, you're going to be seeing us every 3 to 4 months for a cleaning to make sure we clean all of this stuff off so the stain will stay off sooner. She was very pleased that she got to come back more frequently, which a lot of patients are not, but she was thrilled because she was not giving up her vices. So it made her happy. So at the end of the day, she was a repeat patient. So good deal. So you got some homework from this. I do want you to kind of consider some of the missed opportunities you may have had this past week and what your team can do differently next time and how you'll implement the changes. There's lots of opportunities we're presented with in the day to day, and they're small. They can be, your patient came and they were talking about they just don't like the way this one tooth is turned, or they don't like the color of this filling. There's lots of things you can have conversations about that you may have just kind of disregarded because they weren't pressing needs. But if we really take time to listen to them and listen out for their hierarchy of needs, we can create a lot of opportunity in our schedule. So definitely do this. Definitely write down what missed opportunities you can remember from this last week and schedule some time next week to chat with your team on how you'd like to change things up for next time and moving forward. So I actually got through this super fast. I'm surprised. So you can join us for part 2 of the Comp Care series. Just email at info@mentconceptions.com. The part 2 Comp Care is the subject line so that I'll throw your name into the list. And we will also be having upcoming webinars. These will be spaced out over the next year. So, I'm not trying to like cram everything down. We'll have creating effective treatment presentations and financial arrangements and follow-ups and finances, building revenue through consistency. And if you would like to learn more about how we can help your practice, you can hop over to mintconceptions.com, click the discovery assessment so that you can get a free gap analysis for your practice. And I'll highlight some opportunities there that maybe you hadn't considered for growth. And then if you'd like to schedule your consult after that, you certainly can, but it gives you the free printout so that you have that information. You guys can talk about it internally as well. I want to thank you very much for letting me share my passion with you today. I'm really pleased that I got to present this. This has been something that's been in the works. I've done this a few times, but this is not on this big of a scale. So I'm really glad you guys could join me. And if you'd like to learn more about how to contact us, there you go. Again, you can throw any questions you may have in the chat box. The admin will still be here for another, let's say, 10 minutes to answer any questions you may have. And I hope that you guys have a great and productive week ahead.